We are back with Dr. Kardie Tobb, a Cone Health cardiologist, and we're talking about women's heart health. We were just talking about a whole bunch of different kinds of screenings and things in that nature. And I know that there are women at home who are like, I do not have time to make an appointment and get all these things checked off the list. I hardly have time to do anything for myself. But you have a solution to that. You kind of have a one-stop shop community event.
Yes, we do. We've been doing it. This is our fifth year now to really care for the women in our communities. On Friday, we're going to be doing our fifth annual Women's Heart Community event. What that is, it's a combination of educational workshops, a keynote speaker, but most importantly, is what we're going to do is the screening. We're going to help women understand our cardiovascular risk by just coming and getting screened. It'll take you an hour or even less to get your blood pressure checked, to get your lipids profile, your hemoglobin A1C. Talk about, we have a card that has lipoprotein A in the information. We will not be doing that screening. And also get your mammograms done, because we talked about the whole breast cancer, the risk for the treatment for breast cancer. So that is important. I don't see where you're going to go that another day and get all those things in one place, one stop. The most important part of this is you're going to meet other women that you talk about their risk, your risk, how you can work together. You're going to hear information about diet and exercise and the calcium scores that we talked about. How can you sign up for it just right there? Experts are going to be there. You have questions one-on-one with the pharmacist. So it's important. We really want to see people come out because we want to be able to empower women. You give one information to one woman, the next person gets it, her neighbor, her friend, she's integrating her household. It really helps empower people.
Yeah, and how often do you get to have experts like that at your disposal like that for that length of time? I mean, you usually get to see your doctor for like 15, 20 minutes. That's it. So this is really key. Now, let me ask you this. The screenings that are offered, is fasting required or any kind of other special instructions?
Not really. You all the screening that can be done. You can just take your lunch break. Really, take your lunch break. That much time you can get there. We have parking spaces that are free. You can be able to talk. We have bus passes there. You're gonna come and meet us. You're gonna talk to me as a cardiologist, talk about things, meet my colleagues and other clinicians around. So that's important to be able to just even that 30 minutes break that you have, you can come and spend it with us and change your risk for heart disease, get information that's going to help you for the future.
Yeah, speaking of information, how important is it knowing your family history with regards to heart health?
It is key. Knowing your family history is one of the single most important information that you can get, because part of those things we can't, even though 80% is preventable, there are some things that we can't change, but we can help you. So let's say your father, a male first generation person in your family member had heart disease at the age, or a heart attack at the age less than 55, female less than 65. That is key for early screening, and that's where that coronary calcium score comes in. That's where knowing the numbers for your lipid profile comes in. That's where are you diabetic comes in. If family members are type 2 diabetic, it's important as well. That lipoprotein A that we talked about, we will not be screening, but we're going to have good information that's going to be provided to people how they can get the screening and what that means. You want to know that, because if it's high, your risk for heart disease is high. You want to also know that, if you're smoking, what information that you have to stop smoking as well.
Okay, well, thank you for your time and your expertise. And again, that community event is this Friday. If you've got any more questions about that, it's going to be in the To Your Wellbeing section of our website.